There's no way to sugarcoat it. Nobody likes Democrats anymore. We have no voters left because of all of our woke trans bull. Not even black people want to vote for us anymore. Even Latinos hate us. So we need new voters.
Nowhere. We are fighting to protect the health care of the American people in the face of an unprecedented Republican...
But you don't shut that government down. We have disagreements about health care policy, but you don't shut the government down. You don't use your policy disagreements as leverage to not pay our troops, to not have essential services of government actually function. You don't say the fact that you disagree about a particular tax provision is an excuse for shutting down the people's government and all the essential services that come along with it. But let's do it in the context of an open government that's providing essential services to the American people. That's all that we're proposing to do, and the fact that they refuse to do that shows how unreasonable their position is. I think we're headed to a shutdown because the Democrats won't do the right thing.
Mr. Speaker, thank you for joining us this morning. The Democratic proposal is designed to prevent millions of Americans from losing their health insurance, losing Medicaid coverage, or paying higher health care premiums. Why are you against that?
That's an absurd statement, what you said there. Let's be clear about what happened last night, George. No, George, let me tell you what happened last night. Everybody can go and review the facts for themselves. 44 Senate Democrats voted to reject a clean, nonpartisan, continuing funding resolution to keep the United States government open. The Democrats said instead that they wanted to give health care to illegal aliens instead of keeping critical services provided for the American citizens. That's what happened, plain and simple. Every Democrat in the House, except one, voted against the clean continuing resolution. It was nonpartisan in nature. There are no policy riders on it that Republicans favored. It's exactly what Chuck Schumer and other Democrats voted for in March. But they've changed their tune. They changed their tune because Chuck Schumer is having political problems right now. That's just a simple fact, and everybody knows it. He's trying to outrun the far-left portion of his base, so he's decided to inflict pain on the American people.
Here are facts. Here are the facts. The proposal does not provide health care for illegal immigrants. Illegal immigrants cannot buy health care under the Affordable Care Act. They cannot receive health care subsidies. No. Illegal immigrants are ineligible for Medicare, Medicaid, and the Children's Health Program. The Democratic bill does not make them eligible.
It does, actually, because what it does is it unwinds the changes that Republicans put into the big, beautiful bill, the big signature legislation that we passed and signed into law on July 4th. That has been very successful in shoring up Medicaid for the people who are actually eligible to receive it. What we did in the bill, and the CBO just verified this 3 weeks ago, the Congressional Budget Office, the nonpartisan arbiters of everything up here, they said that those provisions have helped to reduce premiums. Why? Because we got ineligible recipients off of Medicaid, illegal aliens, and able-bodied young men who are riding the wagon who are not eligible to be there. Medicaid is intended for specific populations of U.S. citizens. That is young, pregnant women who are down on their luck, the disabled and the elderly. Those resources are being drained from those folks, and so we fixed that. We reduced fraud, waste, and abuse in the program. Chuck Schumer's counterproposal on the CR would reverse that. That is a simple fact.
The CBO did not say that about illegal immigrants. You've made your point right there. Let me ask you about President Trump. He had another deepfake video overnight. How does that help the cause of getting a deal and opening the government?
Look, the president uses social media for humor. He makes jokes. He does lots of things. What the president did in showing leadership, though, 2 days ago, was he brought in Chuck Schumer and Hakeem Jeffries to meet with me and Leader Thune in the Senate to try to work this out. He gave them unlimited time they had in the Oval Office, and they would not come to the table to do exactly, George, what they themselves have said repeatedly over and over and over. We have a highlight reel playing on my social media that shows Chuck Schumer in his own words for the last decades saying that a shutdown would be dangerous and disastrous and reckless. And now he is the one leading his party off that cliff. There's one question that Senate Democrats have to ask today. How long are they going to allow Chuck Schumer to do this to them so that he himself can get political cover from the far left corner of his base? He believes he's going to get a challenge for the Senate from AOC. That's what changed his mind. That's what's driving this agenda. And it's harming real American people. You said at the outset how many people will be unpaid. Many people will lose their jobs over this. TSA agents, the troops won't be paid. They have to go to work. They won't be paid because Chuck Schumer wants to play political games with a nonpartisan continuing resolution to keep the government operating.
The president also said at the Pentagon yesterday that he wants American cities to be used as training grounds for the American military. Is this the highest and best use of the U.S. military, and is this the right way to train them?
I don't serve in the Pentagon. I run the House of Representatives. And what we need to be talking about today is real harm that the American people are going to feel because of what Chuck Schumer is doing. Let me tell you what's going to be
Well, hold on a second. As Speaker of the House, do you answer the question? As Speaker of the House, do you believe it's appropriate to use American cities as training grounds for the U.S. military, calling those people in the American cities the enemy within? I'm asking you, as Speaker of the House, do you think that's appropriate?
I'm not going to comment on your characterization of what the president said. I didn't get to see that speech because I was a little busy yesterday. Well, you can take his quotes out of context, which you often do, and I don't think that's fair to the president. I'll tell you what he's done, though. He's put National Guard troops here in D.C. and cleaned up the crime problem. People can walk safely to and from work today because the president takes crime seriously. Some of the big mayors in some of these big blue cities are not, and I think that's probably what he was addressing there. But what we need to talk about right now, speaking of troops, is that they won't be paid right now because the Democrats are playing political games. FEMA is not going to be provided. FEMA services will not be provided that the government is now shut down. If you have flood insurance that you need to renew before the hurricanes come on, you can't do that right now. We have critical medical services for veterans and their families. I mean, suicide prevention programs. These are really serious issues that are being caused by the government shutdown. And we need the Democrats to put the politics aside and keep the engines running here. That's critically important for the American people. And it's stunning to me that they're willing to play games like this when they themselves have said, go watch the tape, throughout their entire careers, that this should never be done.
Mr. Speaker, thank you. Nothing I said about the president was out of context. Those were direct quotes from the president. But thank you for your time this morning.
Cherry-picked out of a long speech.
Let's turn now to House Minority Leader.
Fact: Democrats shut down government over free health care for the newcomers. And it's a fact sheet. Today, October 1st, Democrats and their fake news allies want you to believe it's all a lie that Democrats shut down the government over free health care for newcomers. Except that's exactly what happened. As Vice President J.D. Vance said, quote, "It's not something we made up. It's not a talking point. It's in the actual text of the bill that they initially gave us to reopen the government. As the White House makes clear in a new memo, Democrats' unserious proposal takes extraordinary efforts to accommodate newcomers while repealing reforms that strengthen health care for American citizens." If we can't agree on that premise moving forward, if we can't say, yes, this is what they did, then we don't have a shot. There has to be a collectivity, a unified voice going, you're lying to the American public, and the media is participating in this grandiose scheme that you're running to try and get over on people. Here's what you need to know. And I love the way they just put this right out there, put it right in your face. Here are the facts. Democrats' proposal would result in nearly $200 billion to be spent on health care for the newcomers and other non-citizens over the next decade, enough to fund the entire CHIP program, Children's Health Insurance Program. Democrats' continuing resolution spend nearly $200 billion on health care subsidies for the immigrants and other non-citizens. And here are all the different sections of the proposal with the numbers attached. Okay, debate that. Forget all the stupid stuff you're hearing on television. If people have a problem, debate this. Those numbers on the far right, as you can see, are in millions. So that 191 that you see there, it's $191 million being allocated to newcomers. Fact: Democrats' proposal would once again allow these improperly granted asylum and parole under Biden's open border scheme to receive Medicaid that you're going to pay for. They're not paying for it. Fact: Democrats' proposal would require Medicaid to pay more for emergency care provided to the newcomers than it does for American patients who are disabled, elderly, or children. Let that one sink in. we're going to be giving more of your money to these people instead of the people here in America who need it most. That's what they want. There can be really no denying this at this point, that this is exactly what they want. Next one. Fact. Democrats' proposal would allow California to continue exploiting a loophole to fund Medicaid for the newcomers, which is what I was telling you about earlier. In the earlier show, we showed you, and that woman spoke, their entire economy is dependent and built upon these people getting free stuff. It all pyramids out. It starts at the top, or rather the bottom, where the person goes to the hospital, goes to the doctor, and then once they get there, every single test that's run, every single prescription, every single napkin, every single sheet, the people who make the sheets, the people who make the napkins, people who take them to and forth, the transportation, is all paid by you. It can't stand on its own. And so their entire economy is based upon you and your money. They like to brag and say, California has one of the biggest economies in the world. No, it's just a recipient economy. It takes your money and funnels it around. If there's no newcomers there to milk the American public, their economy crashes. There's nobody going to the doctors, so that the nurses, so that the x-ray technicians, so that the blood work, it all collapses. They completely rely on generating the funds and billing the federal government so that they can exist. Crazy. Absolutely crazy. Where are we? We're at this one. Fact. Democrats' proposal would reinstate a special Obamacare subsidy for non-citizens, for which the low-income American citizens are not even eligible. Let that sink in. They're going to create or actually recreate a subsidy, giving these people some money of yours to spend while excluding specifically Americans. Not my words, right there. For which low-income American citizens are not even eligible. How is that right?